Thank you, everybody, for coming on. This is Dr. Kristen Carroll, who is professor in the Department of Orthopedic Surgery and chief of medical staff at Shriners Children's Hospital in Salt Lake City. She trained, she got her MD from Albany Medical School in New York, and then did her residency and pediatric orthopedic fellowship here at the University of Utah. She's been board certified for a long time, and
So long.
A long time. I won't say how long. And she is also she also has the honor of having the Sherman S. Coleman Presidential Endowed Chair in Pediatric Orthopedics, which basically means that she's a very important person in the Department of Orthopedics. And we're excited that she has been, she and her department, which has been quite forward thinking in terms of how to integrate and create bilateral exchange programs, has been thinking about a new collaboration with colleagues in Rwanda. So with that, Dr. Carroll, take it away and tell us what you've been working on.
Great. So hi, everybody. I'm Kristen. And if you have questions, please, let me know. So I am so happy to have been able to go to Rwanda. It was one of the most wonderful experiences that I've had in my career. And I was lucky enough to do it with Rebecca Johnson, who is a master's of public health, and she's director of our research, academic affairs, and our global outreach. So she's kind of the silo that everybody dumps their global outreach things into. And we've been trying to think in the department about ways to make it more of a unified program. We have created in our senior year of training now, so our 5th year residents actually have a 3-month block that is elective time. And some of them, choose to go do their subspecialty training that they're going to do their fellowship in, or go to private practice, because we don't see that much. And some have chosen to go overseas to various locations where the faculty have gone. So in addition to what I'm presenting, I hope that our collaboration with Rwanda will give our senior residents another option as well. But anyway, I will tell the story here quickly. So February 2023, my friend Rebecca called me and said, hey, I want to go to Rwanda in 3 weeks. And I was like, I can't go to Rwanda in 3 weeks. And then cases canceled and something, it was just this bizarre alignment of the stars that all of a sudden I could go to Rwanda in 3 weeks, which was unheard of. And so, 3 weeks later, we're flying to Amsterdam and then to Kigali. And I was lucky enough to be able to go not only with Rebecca, but with this incredible group who were very Rwanda savvy and kind of helped me learn the ropes there. Jeff Robeson, Ty Dickerson, his lovely wife, Katie Ward, and then of course Devon Hale, which is the person I traveled to Ghana with years and years ago and is one of my heroes. And then Carolyn Milne, who's internal medicine. So we had this whole group of various folks going, and luckily they had all been to Rwanda before and could help me kind of introduce me to the people I needed to be introduced to. And, why did this happen? And a lot of it is the pitch by Dr. Robeson about the government of Rwanda and the Ministry of Health really wanting to expand training and also care for patients in Rwanda. And so when because ER medicine, sort of peds ER and peds ortho, we spend a lot of time with each other, as you might imagine. Like ortho, there's a lot of trauma that's orthopedics. So he was very interested in having me come as well as sort of a corollary to what he wanted to build within emergency medicine. So trip 1, there are two trips that I'm going to go over. Trip 1 was February. And there were multiple aligned agendas here, sort of what I just went through. Infectious disease. Dr. Hale was going back to look at this incredible infrastructure he's created for infectious disease and the lab in Kigali at the medical school. Dr. Robeson was there trying to strengthen alliances as well. Katie was working on education and awareness for nursing throughout Rwanda. And Dr. Dickerson was working on helping to align Kigali and UEVU administration for all programs in PEDS, which was great. And so we arrived there. This is all of us at dinner on the right side with the fabulous Dr. Hale in the foreground. It was just like magic the minute we landed. This is the OR in Kigali on the left side. So why ortho? Well, you know, at this point, all PEDS ortho trauma in Rwanda is actually covered by adult orthopedics. There aren't any pediatric orthopedic specialists who are at least covering trauma. There are some pediatric orthopedic focused physicians, but they are not necessarily fellowship trained in pediatric orthopedics in their entire, you know, like me, all I do is PEDS ortho. That doesn't exist there for right now. So having some pediatric orthopedic subspecialization, we thought would improve not only the care of kids for reconstruction and stuff, but non-emergent as well as emergent care in Rwanda. And the dean of the Kigali Medical School, it just turns out, happens to be an orthopedic surgeon. So Jeff was like, yeah, please come and talk to him in ortho language and help him know that we're all friendly. And the residency director for the Kigali Orthopedic Residency is the only female practicing orthopedic surgeon in Rwanda. So when my chairman heard that, he's like, oh, Kristen's going to go. And so that's why I went. And it turned out to be just a wonderful thing. This is the beautiful Grace here, Dr. Grace in the pink sweater, along with me and the one female resident as well. So Grace, I can't thank enough. She was a force of nature, not only on the first trip, but also on our subsequent trip, and helped us interview and get introduced to important players there that hopefully can make this a rich experience for both our residents going over there and hopefully their residents coming here, which is my ultimate goal. And then that's just the view of the Chuck Hospital from up above. You're looking down at Chuck there, the red roofed buildings, which is a beautiful place. So I basically followed my team members around. And I met with the dean of the medical school, who's an orthopedic surgeon. He actually came and listened to a lecture that I gave on care of cerebral palsy, which there is not done as much. Certainly neuromuscular care is very, very complicated. It's wrought with complications during operative intervention for sure. And they're just complex issues, you know, and part of my talk was on using Botox, which amazingly $1,200 a dose they're not using there. So we talked about alternative ways to treat that, but it was wonderful to have the dean come. I was able to meet the residents there who are doing orthopedics and some of the emergency medicine residents too. And we took Grace to lunch and basically tried to get the baseline of what was going on. I lectured in CP, but I think what really impressed me, and I know many of you have had this experience, is listening to the residents lecture there, one on total joint arthroplasty and one on shoulder pathology, was unbelievably high level and fantastic lectures. I was just so impressed with this group of young men and women. They were just so dedicated and so well informed. That really gave me a lot of hope that we can hopefully collaborate. The dean of the medical school, as I said above, and then Dr. Charles Bizimana from Gahini was also there. Dr. Charles is one of the 3-4 folks in Rwanda who are orthopedic surgeons who are doing some or mostly PEDS. And Dr. Charles is really interested in focusing on PEDS, and what a lovely man. So that turned out to be a wonderful introduction as well. So this is us with all of the residents who were fantastic, and and lecturing, and then we all had tea, which was lovely. And we were lucky enough to actually go and to the north part of the country and go to a reserve as well. So we were able to see these amazing animals and just drive this beautiful countryside. And see these amazing, amazing people. And I just absolutely fell in love. And I've really fell in love with Rwanda, not only because it's beautiful and the people are really wonderful, but it's an incredibly safe place. And it was a place where I could see my residents going and having an amazing experience and being safe at the same time, which for me was really important because we have many, many not only male but female residents in orthopedics now, and I wanted to make sure that that was going to be acceptable when we're talking about exchanging roles possibly. So I was totally hooked. Okay, so now we decided to do trip 2, where Rebecca and I would go on our own and really look more closely at orthopedics, dedicated orthopedics within Rwanda. So we went back again. Grace was incredibly helpful, and basically outlined for me the 3 big centers that are doing peds ortho. So we met at the Kigali Medical School. I met with some leaders in health education. There are many, many players there, and it's a little confusing. And I probably still don't understand all of it, but I definitely have a more deep picture now. So the pediatric orthopedic picture is divided. There's private and public, as is true in all Rwandan healthcare. Within the public and health, hence the education realms, there really are 3 main locations that are doing peds ortho. Certainly the Kigali Medical School, just because it's kind of the center for education. Dr. Edmund was there. He's one of the folks who does a lot of peds. He says he's probably doing about 60% peds in his practice. Then the Gihini Hospital, and the Gihini Hospital is about 2 hours basically from Kigali. And this is Dr. Charles's center. They also have a very busy ER there as well. But he has a huge clubfoot clinic, which I was incredibly impressed with, and is taking care of neuromuscular patients. They have a prosthetic orthotics lab that's really important in pediatrics, as well as what they describe as a rehab center. And then the third is Relima, and Dr. Emmanuel is at Relima. This is again about 2.5 hours from Kigali. And Dr. Emmanuel is the most senior peds ortho person in the country. And Dr. Protegen also works here. And the reason I'm bringing up Charles and Protegen, you'll understand in a bit, is because we're going to start to do a collaborative exchange here. Relima is more rudimentary with regards to resources that are there, but there are many, many children there. And it was a beautiful place. Dr. Emmanuel is a very kind spirit, but is getting close to retirement. So other physicians are moving in to try to help him take over his work. So first site we went to was Gihini, and it has an inpatient bed of 158 capacity. Dedicated, highly talented physiotherapists there and nursing staff, 3 ORs. They love their kids. Their clubfoot system was amazing. And the neuromuscular care of complicated kids, Rwandan, as well as refugees from other countries, was very impressive. I got to go on rounds with them, and we talked about how to optimize with the resources they have, the care of these children, and that was a very fruitful exchange. They have an orthotic and prosthetic shop, again, very important. So most kids with neuromuscular disease need some sort of orthotic to help them with positioning of the foot and ambulation. And of course, a prosthetic shop for amputations, because as is true, I'm sure, for many of your subspecialties, problems with long-standing infection, and in orthopedics, osteomyelitis can sometimes lead to amputation. They also have an amazing on-site staff housing, which was really attractive to me because obviously if our residents go there, they've got a lovely place to stay. And this hospital is so beautiful. It's up on a hill, looks down over this gorgeous lake. Evidently, the president of Rwanda has a summer home there. And I could see why. It's very lovely. So that's kind of nice knowing that your folks are going to be staying in a place that's so beautiful. But this is a pile of clubfoot braces. And so in clubfoot, there really was a revolution back in 2000 with Dr. Ponsetti, who's from Iowa, originally from Spain, basically had been teaching a method of casting club feet that minimized operative care of the clubfoot. The care for the clubfoot is basically cast for 6 casts as a baby, and then you do a percutaneous Achilles lengthening with local anesthetic, so it doesn't need an OR. And you put them back in a cast for another 3 weeks, and then they come out, and then they're using bracing till about age 3 to 5, depending on the severity of the foot. This has revolutionized the care of clubfoot. So clubfoot is about 1 out of 1,000. It's a big problem. Previously, kids were just not getting any care at all, so they would end up walking with basically their foot turned around backwards on the top of their foot, their dorsum of their foot. And with Ponsetti casting, that has become a thing of the past. So it's really a remarkable thing. And the wonderful thing about Ponsetti casting is that it can be done by a physio. It doesn't have to be done by a doctor. And the physiotherapists that I met there were phenomenal at casting. And we probably casted 30 people the day I was there in Clubfoot Clinic. And then they have, again, a talented orthotics prosthetic, and they use these braces that have a bar between them that spread the feet out like this, that help maintain the correction. And the families bring them back, and they get reused and cleaned up and reused by other families, which is a great way to do it. This was all the physios and me standing there. They were amazing. And then rounds where I'm like drawing x-rays to explain a technique that we use here that's an easier way to treat hip pathology in neuromuscular kids than doing a full osteotomy. But it was a wonderful thing. That's Dr. Charles beside me in the maroon sweater. This is the dean or the head of the hospital, the Guinea Hospital, wearing the blue lanyard around his neck, and he was very excited to have us use his housing, and possibly do an exchange for education, which was really exciting. That's the whole point, right? So the staff were incredibly invested in the well-being of children in Rwanda. Dr. Philippe, who is the fellow in the blue lanyard, met us, really encouraged us to collaborate, gave us a tour of the whole hospital. And this is the housing that is right there, literally across the road from the hospital, within the hospital grounds. And you can almost see the lake there on the right side through those bushes. It's just a beautiful place. So definitely a place our fellows could stay and learn. And Dr. Charles was a total gem and wonderful to work with. So the next site we went back to Kigali, and I was lucky enough to go to the OR with Grace, and Dr. Edmond, who's the one who has 60% peds ortho, as well as residents. There were general surgery and plastic staff there from the UK, so there were a lot of visitors there in Kigali, and I'm not sure, I certainly don't want to step on any toes, and I would love anybody's input on that, because I know there's other programs around. The cases that we did that day were reconstruction from a hemiepiphysedesis. This is something called guided growth, where you put little plates around the growth plate to help straighten angular deformities or limb length inequalities, post-traumatic deformity, as well as late infection. I was working with Dr. Edmond, and we had a little boy who had genu valgum, so knock knees, and he was only 4. In the United States, we wait till 10 because that often auto-corrects. And I talked to Dr. Edmond about that, and I think it was like the one time it was good to be a doctor visiting from another country, because the family actually listened, because Dr. Edmond had been trying to cancel this case. And when I said, oh, we wouldn't do that in the United States, the family was okay with it, and went home. So the ORs have C-arms, which are the radiology equipment, various hardware. Anesthesia seemed to be, I wish my anesthesia colleagues maybe could go with us at one point, because I think that could possibly be improved. But really, they do amazing work. Fantastic. So this is just me in the OR watching Dr. Edmonds and Dr. Valerie, who's the one pediatric, or the one, sorry, female resident, operating on a hand. You can see the look on anesthesia's face there at the top of the table. So the kid at this point had a SAT of like 40. And I was kind of freaking out about the whole thing. And they intubated the kid under the drapes and everything was okay, but it did give me a little spook for sure. So really impressive teaching of residents, lots and lots of pediatric cases, good OR facilities, and great nursing support. Dr. Charles also comes to Kigali as well as going to Gahini. So, there's an academic day on Friday. That's something we could all collaborate with. And in general, I think a U of U Peds fellow could really help set up a clinic or be in clinic with Dr. Charles and help with the education of residents on Fridays. And Grace was very open to that. Housing, again, not available on site in Kigali, but lots of hotels right there. In between these centers, I was able to meet Dr. Alex Butera. He's a spine surgeon, director of surgery master program, and he's at the Rwanda military program. Peds here is very, very rare because it's the military program. But Dr. Butera is very, very respected, influential, and he was very interested in collaboration too. So even though they don't do much Peds there, I felt meeting him was really helpful. And he's very interested in the possibility of doing research between University of Utah and Rwanda, which of course is wonderful for all sides and especially the patients. They were definitely the nicest facilities I saw at the military hospital. Dr. Butera's very dynamic personality. I was amazed when he held our hands in this picture. I took that as a really good sign from a military guy. But he was very open and comes to like the American Academy of Orthopedic Surgery every year. So somebody that I can see also here, which was great. The last place we went to was Relima. And again, this is the most rural location. There were 2 ORs. They were more basic, but also had beautiful housing for healthcare visitors. Dr. Albert was director of the hospital. Dr. Emmanuel, who I previously described, is very close to retirement. The day that he saw me, he graciously sat down and talked to me, even though he was about to do an amputation on a friend's son. Who had a tumor. Definitely more basic resources there, lots of clubfoot casting again and braces, but they're building a new airport in Gahini, and that may change things in Gahini and make it a little bit of a bigger center. That's certainly, I think, what they're hoping for. So this is Dr. Emmanuel in the center, who's like the living Buddha. And you can see there's emergency there, but it's definitely more of a basic center, and they really try to focus more on rehab and physio, although they do have 2 ORs there. So it is again, great housing, beautiful location, maybe changing. Dr. Protegen, who works there, is a younger orthopedic surgeon who's very interested in pediatrics. He moves between the centers, but basically I think will be taking over for Dr. Emmanuel, and is very interested in collaboration as well. There also is one pediatric orthopedics who's actually doing a fellowship in Canada there, but I did not meet them. So we were able to meet Dr. Menelas, the Minister of Health, when we went back to Kigali from Relima. He is brilliant and very forward-thinking. And I was so glad that Grace allowed me. This is Grace again beside me with Dr. Menelas. But I think Menelas for me was one of the most important conversations I had in Rwanda, because this is what he said. I wrote it down when he talked about it, but Rwanda is beyond medical missions that come, intervene, and leave. They are beyond that. They want to create really fabulous medical education and be looked to as a regional resource, not only for Rwanda, but for the areas around them. And you really get that feeling in Rwanda. Certainly, it is the safest country within the countries that are around it. It is the cleanest. It is definitely, their healthcare is more advanced. And so they're really, I think, at a pivotal moment where building education, building research, and building collaboration, but not coming in, working, and leaving, is the right thing to do. And they're very, very open to that possibility right now. So again, he has really clear vision. I love this picture of the kid carrying the whatever, the piece of glass on the moto. But it really, to me, Dr. Menelis really underscored that we need to be thoughtful in our approach. And again, I would love any insight any of you have about that. And to be very highly respectful and collaborative, which I would hope we all would be. And very interested in making sure that Rwandan surgeons, if pulled away from their Rwandan duties, come home with meaningful and documented educational goals and accomplishments. And I think that's fair. And I think that's something we could help offer for them. So Merikose means thank you. And it was just beautiful. There's me and Grace giggling as usual. This coffee's important in Rwanda. Because of the genocide, you know, there are a lot of gals and not as many guys of a certain age. So there's this amazing coffee shop there called Question Coffee, which I loved. And it's run by 30,000 women coffee farmers in Rwanda. And it's a beautiful, amazing place. So we went there a few times and it was wonderful. So back in Utah, when we returned, we felt that the best way to move forward was to actually invite my Rwandan colleagues here to see what we could academically offer that would help them in their programs. And I reached out to our chairman, Dr. Broadkey, and our pediatric orthopedic division chair. We have 11 pediatric orthopedists at the University of Utah. It's a huge program, as well as our fellowship directors. And they are all really open to this. So this is kind of what's happening next. We are going to have Dr. Charles come and visit us. He's coming in July for a month. We have housing for him at the University of Utah. As I said, we have 11 pediatric orthopedists. Although he can't scrub in, we're going to have him go to our trauma room and go through the various subspecialized clinics. So he can see what we do and check off for him things that Dr. Menelis has come up with, along with Dr. Butara, who is the military surgeon. They've come up with a checklist of things that he wants to be trained in. We're going to do that so that he has a certificate of sorts when he goes back after a month. Following him will be Dr. Protejan, who will probably come in September for a month. But my ultimate goal would be, if possible, to have our pediatric orthopedic fellows, we have 2 a year, go to Rwanda 2 weeks each, and then have our senior Rwandan resident come here for 4 weeks and basically do an exchange. And everybody I talked to seemed excited about doing that. Again, in Kahini and Relima, there's beautiful housing. Both sites are safe, really motivated to work together. And we have housing here, so that would work out well. Dr. Protejan's brother happens to live in Utah, so that makes it very easy. But again, Dr. Charles will be coming and observing with us in July, and we're really looking forward to his visit. July, August become very, very busy trauma-wise in pediatric orthopedics. And so I think there'll be a lot for him to see in addition to the subspecialized clinics that we have, like a neuromuscular disease and limb deformity and clubfoot, et cetera. So if they agree, then hopefully we can send over our first fellows in 2025. I would be happy to go with them, of course. And hope for a chief resident from Rwanda here. And hope to work with other U of U faculty that are going to Rwanda. And I mean, I really appreciate this opportunity to talk to all of you because you guys may have other experience or advice on things I might not have thought of on how to make this happen and have it be a really good opportunity for both sides, U of U as well as Rwanda. So it's really an amazing country, tremendous opportunity. I'm really honored to join my Rwandan colleagues in caring for children. Hopefully, I can give you an update in 2025 or 2026. Thank you very much. So there's Rwanda on the left and Utah on the right, hopefully side by side through a bunch of training. So thanks.